Let's discuss the clinical features of various personality disorders. Among this, the first one is paranoid personality disorder. So, the patients who have or who are diagnosed with paranoid personality disorder exhibit the following characteristics. They have an extreme susceptibility towards their partner regarding sexual fidelity. They lack trust. They are very sensitive towards the rebuffs and flashbacks, and they always have paranoid thinking. The next personality disorder is schizotypal, which is also known as schizoid personality disorder. So, the characteristics of these patients are they are emotionally aloof and cold. They are very insensitive, that they do not show sensitivity towards societal norms. They show or sometimes lack and they have limited interest towards activities that provide joy and happiness, and they always try to refrain from social gatherings, and it's proven to be that they have little evidence of having sexual relationships with their partner or even with the other person. The next type of disorder is antisocial. It is also termed to be as a psychopath or sociopath. So the characteristics that they do exhibit are they are totally indestructible in nature. They lack to maintain trust, and they do not know how to maintain and sustain relationships for a longer period. They are highly destructive in nature. They do not care about others' feelings. They do not obey or try to mend with others in the society, and also do not involve in the societal norms. They have poor tolerance to handle frustration and stress. They always use the mechanism called projection to overcome the frustration or difficulties that they go through, and this results in unacceptable behavior, especially towards the society. Let's discuss the nursing interventions of these patients. So the first one is conveying the attitude in an acceptable way. So you need to make him understand that it is not him, that he or she that is bad. It is their unacceptable behavior that is making them perform such activities, and all the promises that are made to be kept. The next intervention is removing all the dangerous objects which are surrounding in the environment. This helps the patient to be safe and the environment to produce stimuli, especially towards aggression, and also to maintain calm and quiet. Help the patient to understand the proper object or the proper reason for him to turn hostile. So, the hostility should end up in such a way that the patient has to verbalize or ventilate his feelings. What is the cause that is resulting him to express his agitation or aggression? The next intervention is allowing the patient to choose many alternative mechanisms to cope up with aggression and even hostile behavior. So, here particularly certain mechanisms are to be deviated or to be converted into socially acceptable behavior. Make availability of more staff and ensure that all the staff that are there would be engaged to cope up with patients, especially in dealing with them, trying to normalize them and making them socially acceptable. The next intervention is trying to make the patient understand why he is being taken care of, and the necessity of him to control his emotions and to ventilate his feelings. Administering tranquilizing agents and also making use of physical restraints if necessary, and also trying to calm down the patient as much as possible. Explain the consequences if the limits are violated, and every consequence should be explained to the patient what happens, and the entire staff should be engaged in focusing with the patient, letting him know that if the consequences are not corrected and if they are not socially acceptable, it could be very dangerous to the client. And also, setting up these limits will also help the client to learn many repetitive and organized mannerisms. So, this particular repetition allows the patient to follow a very desirable changes within himself. Provide positive feedback for every desirable change that you have noticed in the patient. So, they need to understand, they need to focus on what is good at a given point of time, and how socially they will be acceptable in the society also need to be understood by the client. Let's discuss cluster C. So the emotional disorders, personality disorders. So the characteristics that an individual exhibits are they have inability towards maintaining interpersonal relationships, they are emotionally labile, and affect they strongly react towards any particular situation. They have dysregulation towards speech, towards their ideations, and they have very rash driving and sometimes indulge in sexual assaults, dissociative symptoms, and paranoid ideations. They also have suicidal thoughts, suicidal ideations. They are highly risk in nature. They do not know how to cope up with even very small issues and do not know how to react emotionally. Correct emotion is not being expressed at a given point of time. So, emotional disturbances are frequently seen in these individuals. The next type of disorder is narcissistic personality disorder. So, this kind of personality disorder, people exhibit characteristics like they have a pattern of grandiosity, they always have fantasies which are unlimited, and they exhibit unstable or unstable interpersonal relationships. They always seek others' attention. They do actions which need self importance, and where individuals or the entire team or the entire group or people around them should focus on them. They have low self esteem and always do actions where people around them try to admire them and always gain or always try to seek others' special treatment. The next type of disorder is dependent personality disorder. So, the characteristics also go with the name itself. So, they are dependent on the people around them, they are unable to make life decision skill, decision making is very poor in them. If people around them are not to be found, they cannot make or cannot take any decision, they do not know how to react to a particular situation. And they are hopeless and uncomfortable when they do not have people around them, and feelings of helplessness in decision making. The next disorder is obsessive compulsive disorder. It is also called as anarchistic. So, the few people who have this particular disorder exhibit features like they are very stubborn, they are rigid, they are very inflexible, they always aim to be very perfect, and perfectionism is their main ideation. The next type of disorder is obsessive compulsive disorder. It is also termed to be as anarchistic. So, people who have this particular disorder exhibit the following characteristics. They are highly inflexible, they are rigid, and they are stubborn in nature. They always aim to be a perfectionist, and they always aim to have orderliness and very specific or very keen towards cleanliness. They have excessive feelings of doubt and caution. They always expect others to follow the rules and regulations that they follow, and they expect even others to do the same. The next disorder is anxious or avoidant personality disorder. So the people who have this particular disorder, they exhibit the characteristics like they always try to inhibit social gatherings or social norms. They have inadequacy towards negative evaluation, and these feelings they keep carrying it forward for a long, very prolonged time. They have great fear towards rejection and negative evaluation, and they also do not like criticism. So, if a critic is passed, they do not know how to cope up with it. And because of the particular critic, they try to avoid to move with people around them. Persistent fear of embarrassment in social and other gatherings. They do not know how to advise people and also try to inhibit themselves to advise people also. They try to avoid situations which bring extreme anxiety to them.